Gentlemen, a very welcome to Singapore Patient Conference 2016 Care Connect Open House. Thank you for taking time to come for our open house, and I hope that it will be an enjoyable learning experience for all of you. So there will be a series of fun-filled, interactive and engaging activities today. Hence, during our short intermissions, we'll be doing additional setups and rearranging the layouts. As such, feel free to take washroom breaks or stretch your legs outside Care Connect during those intermissions. Thank you for your understanding. And yes, by the way, I'm Jacqueline, your MC for today. So first up, let's welcome our first speakers for today. We have very experienced and dedicated life support instructors, Ms. Zarina, Ms. Carrie, and Ms. Tan, presenting and demonstrating on basic first aid training, CPR and AED to us all. Let's give a round of applause to them.
Okay, a very good morning to all of you all. Thank you for joining us at Singapore Patient Conference. So today, I'm Zarina, and along with me I have my team members, Carrie and Hiang. We will be giving you the basic first aid training, CPR and AED. We are representing the Nursing Patient Education Committee from Tan Tock Seng Hospital. So the outline of our talk is such. Okay, before I go on, can I ask you all, do any one of you all know what is the incidence rate for heart disease in Singapore right now? Any ideas? Just shout out. Any ideas? Any percentage? No? Pardon? 80%. In percentage, is it? 80%. Not that high, but okay. In actual fact, heart disease is the third commonest cause of death in Singapore, resulting with 16.7%. This is according to the Ministry of Health statistics as of 2015. So, the major causes of sudden death include the following: heart attack, foreign body airway obstruction, drowning, stroke, drug overdose, suffocation, smoke inhalation, electrocution, and severe allergic reactions. Last but not least, severe trauma, which is automobile accident. The chain of survival includes early recognition with the access of emergency care, early CPR, early defibrillation, and early advanced cardiac care. When we say early recognition, first, we have to check for danger. Make sure you, the victim, and bystanders are safe. Check responsiveness. Tap on the shoulder. Hello, hello, are you okay?
Hello, hello, are you okay?
No response. You call for help, call ambulance 995 and get the AED.
Help! Call 995, get AED now.
When calling 995, there are certain information that you need to bear in mind. First, the location of the victim has to be informed, the telephone number that you are calling from, what exactly happened, the number of victims involved, ask for an immediate ambulance to be dispatched, and most importantly, hang up only after you are told to do so by the receiver. Early CPR. Position the victim. Lie victim on a flat surface. Check for breathing. Look for the chest rise. To start compression, for female patients, always remember to bear privacy. Landmark. Place the heel of the palm over lower 1/3 of the sternum. Body position, lean forward, elbows locked. Use body weight to help with a compression depth of 4 centimeters. Compression rate is at least 100 heartbeats per minute, and the counting goes as follows.
1 and 2 and 3 and 4 and 5, 1 and 2 and 3 and 4 and 10, 1 and 2 and 3 and 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4 and 30.
Next, in the chain of survival, early defibrillation, arrival of first aid AED. The compressor has to acknowledge the arrival of the AED and continue with the compression. For AED, there are certain safeties that you need to bear in mind before you apply the AED pads. When I say safety, it includes environment and the victim. For environment, ensure the floor is dry. Away from all flammable objects, away from any metal object as well. When it comes to victim, make sure the victim is lying on a dry surface, move jewelry away from the chest, remove any adhesive patch, shave off the hair of the chest if it's necessary. For victims on pacemaker, make sure that it's 4 fingers away. Okay, from here, you'll be hearing the AED voice prompts, so I request all of y'all to keep silent and listen to the AED prompts. Carrie and Hiang will be demonstrating the full 5 cycles, after which I'll be speaking again. Okay? I think the back row of y'all can move in front a little.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protected cover and take out white adhesive. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic lining. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. Press pads firmly to patient's bare skin. No one should touch the patient.
Stand clear.
Analyzing. No one should touch the patient. Shock advised. Stay clear of patient. Press
Clear,
the
everyone.
flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Stop CPR. No one should touch the patient. Analyzing. No one should touch the patient. Shock not advised. It is safe to touch the patient. If needed, begin CPR. For help with CPR, press the flashing blue button.
Okay, so this is the full completion of the 5 cycles that will be done over 2 minutes. In the actual situation, you continue with this until the patient regains conscious or the ambulance has arrived. So this has to continue. Okay. Once advanced care, once the ambulance has arrived, they will be giving advanced medical care for the patient in the hospital. Automated external defibrillator. Automated external defibrillator.
External defibrillator. But we will not be able to get this.
Pardon?
It's available in airport, shopping malls. Yes, airport. It's in the world.
I mean, anybody can be qualified.
Correct. Yes. That's where I'm going to next.
Like very complicated. Even though people like us, unless you do it every time, then you can remember it as
Yes, you're right, ma'am. That's why, if you all are interested, this is just a basic introduction to trigger interest in y'all if y'all want to get CPR trained. So, if y'all are interested, y'all can go to this website and you will be given the list of the training centers where you can get accredited.
Excuse me. Some security guards are being trained to do this, right? Security officers in the malls and offices.
It depends on their organization which they are coming from.
There is a portable one, the red color.
Yeah. The AED, they have the different brands. Yeah. But it's now getting more available in all most common areas like shopping malls, MRT stations, airport, yes, common areas.
Calling these people who are trained to help us. Unless we are, say, on the road and then there's nobody there, then we should be calling the ambulance, right? And then we don't have real trigger training.
Yes, more or less, this is very layman-based. So you will be able to follow the voice prompts. Yeah, but for CPR, when it comes to CPR, you have to get accredited in order to perform CPR in the correct manner.
For the AED, do you really need 2 person to handle it? I thought 2 person is working on it.
Yes.
If you are alone, what can you do about it?
You need to shout for help. That's where the help comes in. So this is how it goes on for the registration. Yeah, you all need to log on to that website. Then you will be given more clearer details as to how to get accredited. Okay. So, any more questions? Pardon?
For the CPR.
Yeah, with the AED, it maximizes. Yes. Correct. Yes, sir. Sure. The website, right?
National Resuscitation Council. Let's say you use a Google search. NRC. Yes. You just type NRC, then you see the National Resuscitation Council. Inside they will show you one list because depending where you stay, then you may want to choose the nearest center. So it's for your convenience. So this is actually certified to actually teach CPR.
Teach or conduct CPR.
Yes, teach and CPR. Conduct CPR courses and certified.
At the end of the day, can we have a soft copy of the presentation?
Organizer, will they be getting any?
No, the first few one, the CPR AED. That's the more interested. At least we can follow up things.
Okay, can. Yes, sir.
Because your question just now about one man, right? So when you found someone collapsed, really not breathing, so no response.
Some of the points I need.
Yes. No. Just now your question about one man CPR. So you just start the compression first. Compression, that's why we say immediately call for help. What's the ambulance number? 995. So get someone to immediately call.
Call ambulance directly and then do the CPR.
Yes, then that's why we ask someone to call while you quickly do CPR. Yes, if alone, then no choice.
Regardless of the condition of the patient, you just call.
Because the faster we compress, the faster the heart is pressing, there's circulation.
Is it done for general public or is it the sickness of person?
No, if the person is unconscious, you see that there's no breathing, the breathing stops, just do.
Even they don't care of the history.
Because you are only compressing. So now you can come forward and touch the mannequin. Then you feel that now you can feel yourself in the center of your chest. Can you see a hard bone there? You can feel it's hard. The center here. Can you feel something hard? So that's the sternum bone. So we are supposed to compress on that hard bone, but it's the lower 1/3. So you see it's from here all the way down, right? So can you feel all the way down? Then something soft, right? So your heels of your palm is supposed to be above that. So it's a low. You can go down if you can. You want to have a feel, you can do feel. Because we have some time now.
Elbow interlock, then your body forward, press, use your weight to compress. Yeah, that's right. Along 1 and 2 and 3 and 4 and 5. 5 cycles. The ventilation is optional. The ventilation part is optional. The ventilation is optional because you just want to maximize the cardiac output. Correct. Yes.
Because sometimes we don't know what to say about
Use the body weight. Yeah, use the body weight.
just compress. You don't want to kiss something. So we just compress. It's better than nothing. Anybody wants to
trained or certified certification. Family members, your family members and friends.
For me, I'm a right-hander. If I use my left hand,
That's not valid.
see the bone here?
That's why for our loved ones, husband, wife, or son, drowning.
You will press down, then your the other hand with the lock elbow straight, lock, body weight, lean forward. Yes. Make it lean forward. Yes. Then 1 and 2 and 3 and 4 and 5. It's not on your bone. Your bone. Yes. That means about force and pinch. 1, 2, 3, 4. Yes.
Is the blowing optional or?
Yeah, it's optional. It's optional.
It's optional. But if you want to blow because you don't know the person, if he has a disease,
Do you feel the nose after doing exercise for some time, whether it's breathing or feel the
It can
heart
come
rate?
back. The breathing can come back too low.
function of in because of the
Just the wrong part to stop pumping. That's why
take a break. Like you can't 1 and 2 and 3 and 4 and 5. And you say that it's a loved one, do it, right?
About the breathing, you have to check the breathing. The breathing.
Yeah. Yeah. That's where you check for the rise and fall. Yeah.
Then open the airway.
Yeah. You just maintain an open airway. Yep.
What happens if the patient down is still conscious?
Oh, then we need to CPR.
All those were certified,
Even the patient is coughing, I mean the patient is coughing, even we are certified, we are not supposed to be only if
Why?
Means only unconscious and not breathing.
Yes.
For example, for the case of stroke attack, sometimes you don't know, right? Stroke. Like me, I just fell down.
So you assess the consciousness. We need more response, then we do something.
Check the heartbeat of one.
Actually, we don't advise to try hard.
Because what happened to me, I just fell down. Unconscious. I just had to the hospital.
But breathing, you can use the...
You look for rise and fall of the chest. You don't check rise and fall of the chest. See, when you breathe, you will rise and fall of the chest. So you don't, they wake up, they will really wake up and rush you away because it's painful when you so careful.
Just like example here.
You feel it, then you you'll just rush the pain away. Move a little, then you know that patient is actually conscious.
Can you go to AED again?
Oh, yes. AED.
The one is more complicated.
You want to come closer?
But AED will not...
How can see quickly about
Okay, come here, sit down. You are trained.
train or train must be
AED available in traditional airports.
I'm more thinking of like...
even if you travel, there's not AED.
Center, they have AED. Yeah. Sir, you want to come closer? Closer, I have a chair.
Maybe come closer, then you all can take a look at the buttons as well.
Keys whereby
Usually on the real patient, you don't look for it. Where's my golden knob? No, it's not available.
this one also don't come with AED. Like,
Adult training.
When you go for training for the CPR, they may tell you do compression with 2 ventilation. So it's always 30 compression, 2 ventilation. But because in the public area, you do not know the person, we do not know whether the saliva sometimes vomiters, we may not want to kiss the person and breathe. So that's why we say just continue the compression will do until help comes up. Then we actually have the mask to actually back.
So the moment they breathe means you can stop.
You show some signs of waking up, then you can stop. That means the person is waking up.
So it's like getting the heart going.
Yes, because the heart has stopped, so the blood stopped flowing. So now you compress, so you're actually replacing the beating heart to help it to beat. So as it compress, the heart blood gets pumped to the rest of the body. So most important is to the brain. So because the heart stops, so no more blood circulation to the brain. That's why they become unconscious. So now we pump, so the blood will flow, then they will wake up. Okay?
But actually, for public, I don't think it's advisable. Would they blame you if something happened?
I think we are trying to do good. Because if we don't do it as soon as possible, within 4 minutes, they don't have any blood circulation, they can actually go into brain dead. It will be very difficult to revive. 4 minutes. 4 to 6 minutes if we do not start the heart. Yes, that's why they are now teaching the public how to actually do CPR, at least attempt the compression. And now they even have the WhatsApp on the SCDF to actually prompt you and guide you through if you are afraid.
Oh, the one is CPR?
Link to SCDF, so there will be someone to guide you through as they are coming. So to tell you what you can do for the person before they arrive.
So this is the on-off, this is the information button, and this is the shock button. All right. Basically, you just follow the instruction from this first aid AED device.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protective cover and take out white adhesive pads.
While doing this, you still need to compress.
Look carefully at the pictures on the
So
white
still doing
adhesive
compression
pads.
as they are
Peel
applying,
one
because
pad
parts
from
still
the
need to
yellow
come.
plastic
So
liner.
must remember that.
Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
You can paste neither, as long as you paste the pad, whether the top one first, the left or the right. Just as long as the two pads is placed, it will start to check the rhythm.
No one should touch the patient.
Now we can actually stop the compression so that they can analyze what's the heart rhythm.
No one should touch the patient. Shock advised. Stay clear of patient. Press
Stand
the
clear,
flashing
everyone.
orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing, place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
So that one is to guide you how to pump. Ding, ding, ding. The timing, yes. Because the public may not know how to forget the count in your panic, how to count 1 and 2 and 3 and 4. So most of the AED will have this, just follow.
And give 2 full breaths. Breathe.
While CPR is continue, you have to actually maintain this
Breathe.
open air.
Continue with compressions.
We have to stimulate the blow, but then
Oh, that is where the kissing part.
yes.
How about if the person has a pacemaker? Is this going to
Pinch nose, tilt head, and give
No,
2
just place
full
the
breaths.
heads 4 centimeters away from the pacemaker.
Just as long as the pad is not placed on the pacemaker, so 4 fingers away.
be away?
Just now when you hear the alarm when it was charged up, then that means the current is ready. So that's why you must make sure nobody touch the patient. Loved one don't hold the leg, hold up chest, then they'll be shocked together. So that's why I say stand clear, make sure don't touch. Then you press the orange button.
Breathe. Continue with compressions. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Stop CPR. No one should touch the patient. Analyzing. No one should touch the patient. Shock not advised. It is safe to touch the patient. If needed, begin CPR. For help with CPR, press the flashing blue button.
Yes, your ambulance would have arrived, ma'am. Usually they'll dispatch very fast.
Do you have statistics to say how many people saved because of CPR?
How many patients are saved? No. But recently, according to the papers, there has been laymen who are saving people who are collapsing in the public. So I think recently there's 3 incidences already. So they are really encouraging the public to involve in this training to get accredited. Yeah. All of them survived due to the CPR.
Is this man provided
No. That thing. No, it doesn't come with the mat, but the AED bag, it will come with this items. Consists of scissors, shave, and certain adhesives.
So it doesn't conduct short we do a swift shape as much as we can. The area where we need to put the pads correct.
User-friendly because they give the instructions. Better than computer. Most of the machine are more or less the same.
The metal. Oh, this is because it's a mannequin. We need it to conduct the electricity, so the metal actually helps to receive it. Yeah, in actual human, it will be more appropriate.
The actual vibration,
No, because this thing is actually conducting the electricity. It's passing the electricity onto this mannequin right now, so it has to absorb. Yeah, that's why it's the metal. In the real human, you pass it to the heart directly. This one doesn't have a heart.
If we place the pads now without this metal for long, to be burnt because the electricity transmit to the pad. So we use the metal to actually absorb.
That's why you will not have this burn mark over the mannequin.
Yeah. But in actual life, we need to because we need to put the electricity towards the heart to get the heart going again. In layman's terms, there's 2 pads. Yes. Gel.
Any more questions?
Place on the left and then the patch.
You just have to follow the pictures, sir. Yeah, it very clearly states. Yes.
Anybody want to try the AED? Who is game enough to go and try?
I know your instruction.
Yeah, we will guide you through what.
I thought AED is supposed to have an AED means that someone's certified, right?
But we have the AED is because the machine guides you. Even if you're not certified, you'll be able to listen to the instruction.
But not everyone, I'm lost. You say AED is only found in places like shopping malls and all that, right? And there will be security guards and all that. Is it?
Even sometimes in the community center also available. MRT also.
When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully. Peel the second pad from the yellow plastic liner. Press pads firmly to patient's bare skin. No one should touch the patient. Analyzing. No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now. flashing orange button, shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing. Keep time with the beat.
Lock your elbow. Use the body weight. Yeah, lean forward and press. So you just follow. Just follow the instruction again.
Breathe. Continue with compressions.
CPR continues for 5 seconds.
Breathe. Continue with compressions. Pinch nose, tilt head, and give 2 full breaths. Breathe. Stop CPR. No one should touch the patient. Analyzing. No one should touch the patient. Shock not advised. It is safe to touch the patient. If needed, begin CPR. For help with CPR, press the flashing blue button.
Actually, a good compression when we do CPR must be at least 2 inches or 4 cm deep. So during the demonstration, you can see that actually I go very soft, but in actual life, let me show you. So basically the heel, 1/3 the sternum, hands interlock with the fingers, arms not like that, lock, using the weight of myself, lean forward and go 1 and 2, and this is the actual depth we are looking at, 4 cm at least. So let me go with 1 cycle. 1 and 2 and 3 and 4 and 5, 1 and 2 and 3 and 4 and 10, 1 and 2 and 3 and 4 and 15. You see that my arms are still locked, my body weight is still pressed forward. This is the right way when we do CPR. When we do this, it's actually not effective for the heart at all. So look at me again. Arms locked, fingers interlaced with each other, 1/3 of the sternum, body weight in front, 1 and 2 and 3 and 4 and 10, 1 and 2 and 3 and 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4 and 30. Sometimes you may hear that the rib bone it breaks, this cracking sound. It's actually common. Because we need to go 4 cm. Lung is more important in this situation. So it's actually quite deep, at least 4 cm. So as I count, I can't go 1, 2, 3, 4, 5 because we need to stop in between. So N, the A and B N is to us to pause. 1 and 2 and 3 and 4 and 5. Yeah, we don't go like 1, 2, 3, 4, 5. No, that's the right counting. As you can hear from the AED, we don't go yeah. So it's just for labor to complete. Yeah. Basically, our heart don't pump like that. Yes. So we need to do a lot of
you encourage like people like us who have no confidence, no certification to do it, not having enough ready, breaking inside their body and stuff.
Yeah,
would it be worse or not?
Okay, thank you. Thank you, Miss Zarina, Miss Carrie, and Miss Tan, for demonstrating to us CPR and AED. All right, shall we right now have a 10 minutes break, then come back by 11 a.m. and we'll have the next talk called the Mindfulness Program by Branch Center. So there will be activities interspersed in between, so there will be engaging, fun-filled activities. Yeah, thank you.